Hi there, this is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care is a model to practice primary care with autonomy, joy, and professional fulfillment. It is where I can be empowered as a physician, but more importantly, it is where my patients feel seen, heard, and empowered. I am Dr. Nas Mohammad of Ussra Medical, and this is my DPC story.
Dr. Nas Mohammad is a family practice physician and a sports medicine fellow. He practiced primary care and sports medicine for 3 years after his fellowship in San Francisco with One Medical Group. He worked there as a PCP, specialist, medical director, CME/medical rounds coordinator, and EMR consultant for the engineering team. After 3 years, he joined Circle Medical, another venture capital-backed practice, and was there an operations lead. He started Oster Medical in 2020, the most magical year. Welcome to the podcast, Dr. Mohammad.
Thank you. Thank you.
So I want to start with your Google identity in terms of when I search for Oster Medical, the search comes up as that you are a gay-friendly private doctor. Can you share with us your own story of your identity coming out and your risk of being persecuted?
Yes. I know this may come off a little intense for some of the people listening to us, but this is a very important part of me and of my story. And I'm finally comfortable being in my own skin and not afraid of being found by those that want to hurt me for being who I am. I grew up in Qatar, also pronounced Qatar, which is a small peninsula off Saudi Arabia on the Persian Gulf. It's between Saudi Arabia and Iran in the Middle East. I spent the first 18 years of my life there. My mother was an orphan and my father was a second-generation Iranian immigrant. This was the first thing I had to learn to be in the closet about, my Iranian heritage, that is. Qatar has a very classist system. They even discussed having tiered passports for their citizens at some point. I grew up extremely religious and of a Muslim faith. That did serve as a pillar of strength for me during some really difficult times in my childhood after my parents divorced and me and my siblings faced a short period of homelessness when we were young. The mosque served as a shelter in a way, and faith was a hope for me at some point. The story of me working my way through that life to a high school for gifted children is a story for another day, perhaps. But I was a diligent student, and following my high school graduation, my father and I were invited to the Royal Palace in Qatar with the other 9 top graduates in the country. And in the year I graduated, we were all offered royal scholarships to pursue higher education if we met the admission requirements. So that's where my journey, my pre-medical and medical school journey started at Cornell University, that also had a campus in Qatar. After learning about the needs that Qatar had in different areas within and outside medicine, I chose to pursue sports medicine training as Qatar's very first sports medicine physician. Shortly after, they decided to invest in the field locally, and all of that happened just prior to them winning the 2022 FIFA World Cup bid. There are a lot of issues and controversy surrounding that. And I chose family medicine as the baseline training before going to sports medicine to have broader scope of practice if I was going to go in as one of the first Qatari sports medicine physicians. As I was going through my medical journey, which, it takes 12 years at least, right? If everything goes well to go through the whole thing. I learned more about myself and my sexuality. I also come to learn, unfortunately, that my home country, Qatar, punishes homosexuality by the death penalty. There are very few countries remaining that still do that. Through some friends in Qatar, also, I got to learn, unfortunately, that they have a gay police division that finds and imprisons LGBT individuals and force them into some sort of conversion therapy program. I remember stories from the 80s and 90s of men getting lashed publicly for flirting with women, and this was just men talking to women. Things were much, much worse if it was found out that you were a man interested in other men. I decided to come out to my family in 2015 and move to San Francisco, where I took political asylum. So that was my background.
I've said this to you before, but I'm so honored to know you and, to call you a friend. But I cannot even imagine the day-to-day what you had gone through, especially once you were more in touch with your sexuality and also finding out about the police. I can't imagine. I'm so glad that you are here and that you are able to reflect on what you've been through as you take care of others who I'm sure have been marginalized as well.
Thank you. That's really kind of you. It took a lot of loving people to stay strong.
Now, on your website, you have something that is definitely 100% inclusive. Your tagline says, "Be seen, be heard, be you." What does that mean to you?
Thank you for asking that. So this just happened like earlier in January. And it was part of an exercise where, following the recommendation of a lot of DPC physicians on Facebook and through different meetings, recommended story branding and learning how we can be the heroes in our patients' stories. So this is where this come from. So after going through the content, I went back and looked through every single patient that I have right now and wanted to see why they're seeing me, why they're choosing to see me as their physician in my model in San Francisco. And it really came down to this. They wanted to be seen, heard, and be themselves safely. And so I decided to change that to be the first thing you see when you land on my website for patients. And, I changed a few more things actually on my website. I'm just trying to scroll through right now as we're talking. I ended up also, as part of that exercise, deleting 2/3 of the words I had on my website, which was a risky move. I just realized I was being really wordy. It's really hard to describe a healthcare model, right, to a person that's not in it. Even if it's a another physician, right? Like that hasn't heard of DPC. If I try to go and describe what I'm doing to them, it can get convoluted really quickly. So I just basically changed everything to be about what I'm doing more than about how I'm doing it. And then I can talk about the how once I engage somebody. And yeah, some of the patients I have really complex medical needs that just could not be handled in traditional system. Some went through traumatic experiences similar to mine and now need to stand on their feet. I also had someone that was choosing to suffer in silence at home with their medical conditions and not be on medications and not have them refilled because they were just choosing to go through that and engage in another abrasive encounter in healthcare setting. So I would say I would describe all of those with these 3 words.
It is a great book. And I think that...
Okay, did you go through it? Do you know which book I'm talking about?
Building a Story Brand by Donald Miller. It's such a great read, and I'm glad that it has helped tailor your website even further towards your patient population.
Definitely.
It's heartbreaking to hear about, that the patient who would rather stay at home versus facing the fear of being treated poorly by a healthcare professional. And again, though, it goes back to your story and your history, teaching you empathy so that you can take care of your patients in a better humanistic way.
Yeah. It might be also a good place now to mention that Ussra, which is the name I picked for my practice, is also reflective of what this means to me. It means family in Arabic. And a lot of my patients have lost their birth communities and sometimes even their birth families and are building or have built a new family for themselves in San Francisco. So I wanted to create a fear-free setting for them to seek care where they can be themselves and thrive, knowing that they're among their chosen family.
Now, I want to draw attention to the fact that you chose DPC after coming from some pretty big names. So you were involved in One Medical, you were involved in Circle Medical, and also Forward Medical. And the question that comes to my head is, why did you choose to leave to open up your own practice?
Yeah, so I worked at One Medical and Circle Medical. I'm familiar with Forward Medical, but I have not worked with them directly. I think my experience at One Medical and Circle Medical was overall positive, and reflecting on it, however, it did not help me sustain my passion for medicine, and it did not keep up with my pace for personal growth and professional fulfillment. And One Medical was the first job I took, after I came to San Francisco. So I definitely had a lot on my plate as well when I first moved to the city. And I think One Medical was a great place for me to start practicing medicine. And I got really to experience what it's like to not be in control of my practice as my panel built up over there, right? Because I was a primary care physician, but also I was a sports medicine specialist for them. So I had about 100 PCPs referred to me for their MSK cases in the city, but I also had a large panel of patients that I was managing. I do love and enjoy innovation in healthcare and its delivery. I believe that the DPC model, though, is a setting where most innovation in primary care and delivery can happen with less obstacles. I still continue to work with startups right now on the side in San Francisco through VC companies and such, just because I was in the space. And I love it a lot more, I have to say, right now than I did when I was employed at One Medical and Circle Medical. I just don't believe that this innovation should ever come at the expense of patient safety or quality and valuable care. And I also do not believe it should come at the expense of the ones that are delivering the care. So it really comes back to being in control, right, as you innovate and explore different things. And I just want to say, when I say quality and valuable care, they're just such buzzwords, right? For us that worked in primary care and healthcare in general. And I just want to say that I'm not referring to those set of metrics that are used to sell us to employers and insurance companies. I'm talking about things that we as physicians and patients value, which unfortunately is different from the definitions of valuable care in traditional models. So this is why I left. This is why I left and started my own DPC practice. I left to maintain my craft, skills, and passion for medicine. I also left both companies with the best feedback that they have ever given to physicians in their systems. Just putting that on the record. So I wasn't a troublemaker on my way out.
That's fantastic. No, Nas, you have been open at the time of this interview almost a year, and you are bringing value to your patients because you're growing steadily. And so, like you clarified, the value that we're talking about is not the value that CMS is talking about. Can you share with us about your patient population that you're bringing that value to? Stay with us. We'll be right back. My DPC story just hit 100,000 downloads on Apple Podcasts alone, and we could not have done it without our amazing listeners. So to thank you and to celebrate this milestone, we're giving away an incredible DPC Summit prize package for the DPC Summit happening in Minneapolis this summer. The prize includes My DPC Story swag, and on top of that, the prize also includes a ticket to the DPC Summit. Check out my interview with Dr. Jeff Davenport, where you'll hear more details about the summit. To be eligible for this giveaway, all you have to do is first rate and review My DPC Story on your podcast listening platform. Pro tip, if you rate My DPC Story with a 5-star review, it helps the visibility of the podcast and it helps others to find all these DPC stories. Number 2, take a screenshot of your review and email it to support@mydpcstory.com. You'll find that email in the show notes as well. And third, make sure you're following My DPC Story on all your social media platforms: Instagram, Facebook, TikTok, YouTube, LinkedIn, and Twitter. All the social links are at the bottom of mydpcstory.com and also in our show notes. For bonus points, share both this episode and the My DPC Story posts about the DPC Summit with your community. The winner will be announced in a future episode, so make sure you tune in to find out if you'll be heading to the summit. If you've already purchased your ticket and you're the winner, My DPC Story will send you a check for the price of your ticket. Thank you for listening to My DPC Story, and best of luck.
That's a really good question. And I'm still going through this exercise, right? And the reality is there is no one definition for value. And I'm coming in terms with that. I think value is defined differently by the people receiving care. And whatever cookie cutter you create, it's not going to fit everybody. It's just not. And I think I have the time and resources to adapt to that definition of value for each person that sees me. And I try to find common grounds, like among my patients, right? I actually sat down and put them all on a spreadsheet and really tried to try to find what is it that they all seek. And it's just different. Everybody has their own life story and their own reason to see me. For some of them, it's that they're going to get MD-led care in my practice. For some, it was about knowing that I will read the specialist notes when they come back to my office. For others, it was about knowing that I'm not going to treat them differently because they are who they are. For others, they just needed higher touch point that I can afford, right? And they can afford themselves too in my setting. So these things are not measured, right? Like when you look at any value-based system or metrics in a traditional system, they really they end up having a small list and checkboxes. And a lot of people are left unseen when you do something like that. So yeah.
It's very true. When in fee-for-service, you get presented with your monthly, how did you do summation? If your A1Cs are not on average below a certain number, it does not say anything about, a wife just lost her husband. And so the diet went out the window and exercise stopped altogether. It doesn't talk about the, male not getting to the patient with their medication. So yeah, exactly. It is so true. Also, the fact that you're saying, value means different things to different people. That's as it should be, I think, in that, you as a doctor with a growing, successful DPC are fulfilling that value for all of your patients because you haven't had a single person leave since you started.
That is correct. Yeah. And I operated almost exclusively during a global pandemic. And, in my 7x7 area, there are at least 50 different primary care offices that I know of. And I keep learning about new ones. I just found out a new one just yesterday. But they're all open. They're all accepting patients. They all have different models. cash-based, fee-for-service, membership-based. You think of it, all of them exist around here, and they're all accepting patients. So for me, before my 1-year anniversary in San Francisco, to reach a point where I'm covering all my business expenses is a huge milestone for me. And I'm really grateful that I was able to achieve that.
I wonder, Nas, have your patients, did any of them follow you?
So that's a good question. So when I left, I did have a wait list when I left my old job of patients that were going to follow me. But then COVID hit, right? A lot of them just left San Francisco. Because that's another thing. San Francisco is not really home to a lot of people. There are people that have been here a long time. And I like to think now on top of my head, I think the far majority of my patients now have lived in San Francisco for a long time, which is different from what I had at my old job. I had a lot of people that were transient in San Francisco. So I'm like in a way different population. I had like maybe less than 5 people that were with me before. So it's a small percentage, I would say, that I used to care for. One Medical, but then the new ones that joined me now and to seek my care are also utilizing One Medical and other practices for various reasons, but still choose to see me and my model to complement what they're getting.
Just to be clear, you have patients who didn't follow you, but who have One Medical coverage and still choose to see you.
That is correct. It's about 80% of my panel right now.
That's amazing. That's just amazing. Congratulations on that. That's, again, speaking to your value as a person and as a physician.
Thank you. And 3 months ago, I got an official referral from One Medical to my practice. So I feel very accomplished.
Now, in your practice, I can just imagine that your demographics have people who might be struggling to, put food on the table to people who are 7-figure earners. And do you have anything set up to help those who have less financial means to pay for their healthcare so they can still access your care?
Yes. So this is something I was hoping we would touch base on. So I wanted to start my practice. I did attend some basic courses through like the Small Business Administration and SCORE, which is a national nonprofit for people to go in and learn basic business skills, because I had none at all. I never owned a business before. So I needed to learn how to write a business plan, how to write profit and loss statement, how to do basic bookkeeping and QuickBooks and all these things, and marketing. And it was really helpful. It was not expensive at all. Like some of these workshops, like the most helpful workshop I attended was a 1-day workshop for $50. And I learned so much from that. It was the highest yield thing I've done. And through that, I got really helpful information just about San Francisco demographics, right? Like this information is public, even through the public library. Like you can go and just access so much information. And it was interesting to just learn about my city. It was very different. A lot of people don't live in it for more than 2 to 3 years. A lot of people are young. They're under 40 years old. And a lot of them work in tech, and there is the huge income disparity that you mentioned, right? So there are the people that are millionaires and billionaires, and there are the people that live paycheck to paycheck or not even. And the cost of living in San Francisco is really high. So it's probably the highest per square foot for commercial lease spaces in the country. And also there are a lot of associated expenses of opening and operating a business in San Francisco, I learned while doing this. So I had to include all of that in my business plan when I was designing my model, right? And then I also had to prepare to see what my value proposition is. A lot of startups do that when they go and compare what's in the market to what they're going to bring to the market and why you would attract people to you, right? So there's those 50 plus primary care offices, within 7 miles from me. Why would people come and knock on my door and not other people? So I had to think about that as well. And so I decided to use the DPC model in premise and cut it differently to fit what I think was going to work for me in San Francisco and for the patient population that I chose to focus on. So I decided to open a practice that would serve everybody, but I wanted to focus on a niche market. And that's the LGBT people, and specifically gay men that live in San Francisco. And the reason that I narrowed it down to this is because, one, I'm super empathetic and passionate about caring for this population, and brings me joy. Actually, before quitting my old job, I had a spreadsheet for maybe a year where I, there are like all these moments when you're working, and moments of joy and moments of deep frustration, right? And you're like, you can't tell what's causing what. So I just put it on a spreadsheet over a year and really wanted to know. Like at that time, I actually was questioning even if medicine was like right for me. I had a lot of days where I just felt very defeated. And after putting it on a spreadsheet, I realized that my biggest moments of joy come from caring for patients. And a lot of my frustration had to do with the system. I probably didn't have to do a spreadsheet to like come to this conclusion, but I had to. And sometimes it can get clouded, right? Sometimes you can really be like so absorbed in a case and you're like, this case is so frustrating. But then once you analyze it, you realize that it's not the case. It's not the person. It's not the conditions they came in with. It's how the two of you engaged, right? The premise of the engagement and the restrictions that were around it. So like, it was really about that. So anyway, so that was one reason that I picked that population, because I really had a lot of joyous moments caring for them and helping them with the small wins. But also when I was put on the menu in my old job and was presented to a large segment of the people, gay men chose me as their primary care physician disproportionately. I had like maybe 80% of my panel was gay men. Women in general were like not likely to choose me as their PCP. And I think it's because like they're just more likely. Like in my old office, I was the only male physician. I had 5 females. So I think in that office, they just chose to see the other women. I had like very few female patients that chose to see me for their care. So I decided to use this information to my advantage. So I was like, I wouldn't have to swim upstream, right? Go with what people would naturally select. So that was the one idea I had. And then I was like, okay, so now I know that patient population is probably going to be seeking me, even without me trying to find them. And then when I look at that population, you definitely see the disparity in income that we mentioned. So I decided to create a Robin Hood model. I don't want to really call it that, where I wanted to offer the value and even more than what like a traditional DPC model may offer to the patients that can afford it. But I still didn't want to be cost prohibitive. So I know some huge practices in the city charge close to $20,000 a year in retainer and such. So I'm not there, but I'm also more expensive than the traditional direct primary care model. So my pricing is around $250 now. I'm considering changing that, but I'm around $250 now. And for each person I have that's a paying member, I try to take on one local artist, self-employed person, or an asylum seeker for free, so that they don't have to pay me anything to get medical consultations, and they can still like take advantage of the wholesale on labs, meds, and imaging. Right now, like I grew my model with 1-to-1 ratio, and I think I'm going to continue doing that. I have a wait list for people to join my free membership. I'm trying to be conscious of that because I don't want to be too busy doing free things and then like have my business die because I'm just too busy doing things that are not revenue generating. So my check is to basically try to compare how many paying members I have to the ones that I'm caring for free over time. And the vision is to eventually hire somebody once I'm busy enough, once I hit a critical mass of patients that are paying members. And then I would be able to take probably more patients on in 1-to-2 ratio, so that in the mature model, like I would still have the average price per head in a way, if you want to look at it that way, of caring for a patient. But I am not getting all that membership fee from everybody. I don't know anybody that's really doing this model. I'm not sure if it's going to continue to grow, but it seems to be working. I am not marketing it that way. I'm not saying, oh, sponsor a person by being a member of my practice. The way I'm looking at it is that I am offering this valuable experience for you for a primary care setting that you value for your own reasons. And I'm delivering it for you for this fee. And now I have this time available and I'm choosing to give it to these patients. And this is really helpful. Like it's been really great because a lot of the patients that are in the free program are also micro influencers in the community. So they get the word out about me, which adds to my credibility in the community. And I just started a thing with a couple of them where one of them approached me asking for like a business to business kind of agreement between us. It's a local drag queen. She wanted to use the space sometimes to film like video drag shows and things like that and use the internet. And in turn, they would feature me to their audience. So I thought that was a good idea. It's easy marketing for me, right? And it's reaching my demographic. So I just started that. We'll see how it goes. But this is where I'm at right now. So I think with this model, I can reach most people that live in San Francisco full time.
It's definitely unique. And I think that, again, going back to that marginalization idea and the income disparities, how wonderful is that, you are becoming known as like your Google search, provides a gay-friendly private doctor who allows people to be seen, be heard, and be themselves. And, at some point, as your model changes, that your numbers might change, but you still have that at the core of your mission. And, I love the spreadsheet. I love that you did that. I'm sure looking at practice now compared to what your model was at One Medical or Circle Medical, I'm sure that just makes you so happy just thinking about how you're doing this. You're doing this model and you're thriving.
Yeah, I'm definitely happy. I'm super happy. And I'm delivering what I was delivering before, but I'm being rewarded for it and I have the time for it. Like I remember, I'm sure like a lot of listeners that are physicians would relate to this, but like a lot of us stayed after hours, right? Like for the one person that's sick that needs to hear that they are dying or have terminal diagnosis or like whatever. Just like when you break bad news to a patient, like that can't fit, right? In the traditional model, 20-minute vid template. And I got a lot of pushback in like just getting time to care for such patients. So I had to come from my own time. So I always delivered this kind of care to the best of my ability, but now I can do it without it like taking too much out of me every day. So that feels great that I'm in control of that and in control of delivering value defined by the patient, right? If the patient wants to pay for my time, for me to hear them talk for 3 hours, then they can do that. I don't have to come up with a billing code for that. Like it doesn't matter. And that just feels good. I love the centralized billing and I love not having that be an agenda like every half hour. It's just more authentic, and patients see that it's different.
Absolutely. As you're saying that, I think about those situations where I am running behind and I feel so bad and I'm rushing or I'm choosing not to chart or choosing not to log into the broken computer because I don't want to be late. I don't want to be any more behind.
Mm-hmm. Yeah.
And when absolutely you need to give that the care that the patient or their family deserves when, terminal illness, yes, a person who is coming in from out of town because their mother or father is having memory issues and they're not sure what to do. And that is not a 15-minute conversation, not a 30-minute conversation. Filling out your post form. I mean, even that can take 45 minutes or longer, depending on how much a patient has questions. And so I absolutely empathize with what you're saying.
Exactly. And I'm sure like we all have stories like talking just about value and how it's perceived by the patient. I remember once I had a patient with wrist pain and like to me, the patient had very classic carpal tunnel. Like there's no question about it. And I did the whole thing. And I was like, I explained to them why it's carpal tunnel. And then I went through the treatment and just like went through the exercises and how we're going to make it better and everything. And then the patient left and gave a really bad review. And I was so shocked because I thought I did a really good job. And then reading the like following note from somebody else that they saw in the system, the patient was really upset that I didn't tell them why they don't have MS. That was the thing that they were scared about. And to me, that was a good thing that I always think of this story and always try to define the patient's agenda. Like I ask that very, very, very directly. And just to know where they're coming from and what would help them sleep at night and what would make them feel better, not only actually be physically better, right? Like you need to take care of the whole person. And that, I just didn't have time to do that. The system, there were too many people every day. So it was really hard to deliver every day on every single person. But now I can easily do that. I can completely deliver 100% on all levels for every single person.
Now, I want to draw attention to your website because you have this amazing video, very up to date because you're in your mask and your MRSA gown, cleaning and turning the room over, opening the door for a patient, basically representing the patient experience when they come to your clinic. And I noticed that it's just you. So I want to ask you, in terms of, surviving in San Francisco, I'm assuming the way that video, it's just you, there's no staff. And I'm guessing that has also helped with your overhead.
Yes, that is correct. So I am a solo doc and I have been like, if somebody is thinking about starting their own business, this is definitely the most valuable lesson. Everybody says this everywhere. Any setting you would go and attend, hearing about starting and maintaining a business, keep your overhead low, especially when you're starting, because surviving is really the name of the game. And 2020 definitely proved that, right? During the pandemic. And so for that reason, I really, like when I designed my overhead, I kept both my personal and business overhead in mind. And I wanted to come up with a model that would not need to be rushed or compromised in any way for it to grow. Wanted to stay strong and maintain what I was promising to everybody over time, without having to come up with alternative methods of revenue. So in that journey, I decided to be a solo doc with no staff. So I do everything on my own. I leverage technology to help me with booking for the patients and scheduling and triaging. And I do everything on my own for the referrals, faxing and imaging. I draw my own blood in the office for blood work when patients come to see me. And it's been great. I have time to do all of that. And it's helping me grow and helping me just continue to deliver the care that I promised each one.
And Nas, in terms of you wearing all the hats for your practice, how are you going about marketing? Because that's definitely something that you touched on it with regards to the micro influencers who are your patients in the local community. But are you also doing your own website design?
Yeah, so I did my own website, like a lot of DPCs probably did, use Squarespace. And the one technical expertise I needed a little help with was search engine optimization. So that was the one marketing effort that I invested in. I paid $1,600 for that and for 6 months worth of work, which I thought was completely worth it because it already paid at least 5 what I paid already from direct results from that effort. And most of my new patients come from organic Google searches. And that was the one exercise I had to go through. So I had to think of what terms my patients would look for in the Bay Area, in the saturated market, and like trying to find me. So I started blogging and writing a lot of articles that are relevant to them and use keywords that I think they would use. And whenever I have my initial intake call with somebody new, I ask them how they found me. And most of them have used the search terms that I thought they would use to look for me. So that has been super helpful. But now I'm looking into other ways to market myself as well as social media. I'm just learning from other DPC docs. And yeah, marketing can be like an easy way to lose a lot of money. I think whenever you just have a moment where you're frustrated with the rate of growth, it's just so tempting to go and just drop a lot of money on Google ads or Facebook ads. But in my small area, like that can easily be wasted, right? Like I really need to reach the people that are likely to use me. And that has been the tricky part in a way. But I think a good lesson from other DPC docs and also my own experience, I think building webs like online presence is very, very important. And you really need to think like your patient would think when they need you, and then just help them find you online.
I think that, access to you as a doctor because they're a patient is important, but for those potential patients, that access is definitely impacted by your social media presence or absence for sure. Mm-hmm. Now, recently you wrote a blog that I can't remember the name of the blog now.
Is it the one a lot of people just landed on? The one you're referring to?
Yeah.
Yeah. So that was like it's almost clickbaity, which I didn't love about it. That was okay. I wrote it with the recommendation of the search engine optimization team.
I gotcha. Okay.
But the title of the article is The Benefits of Seeing a Gay Doctor. And then it just goes over all the different items where like LGBT friendly or gay friendly clinical settings can be helpful to bring up different issues a person can go through. And that has had so many hits internationally, like every day from all over the world. Like I would get, I'm looking at my Squarespace analytics tool to see like how many people visit my website, and more than 70% of my daily visitors land on that article everywhere. So when you look that up, I would probably be the top number one hit for that anywhere. And it's definitely helping my website rank locally as well. So that was the thing. When I first started, I thought that the most common term people would search for looking for me would be gay friendly doctor or gay doctor in San Francisco. And when I first put my website out, I was buried in page 5 or 6, but then through blogging, I'm now number one hit in San Francisco. If you look that up, I'm competing with the number one. We keep going back and forth, but his panel is full, so I'm the second option. In a way, the only option. And I think a lot of people still skip the ads. And I mean, I do this personally. I don't know what you do. When you try to look for something, I have this tendency to skip the ads and then try to see the organic hit results. To me, they're noise. I may glance at it, but then I immediately go to the organic hit. So my target was to be there in the organic search results, because there is a thing with being found versus pitching somebody, right? I think it's just approached differently. I don't know. That's at least my consumer experience.
I see ad and I like that they put that so I know to skip them. I absolutely will, whatever I'm looking for, I will read below those, but usually on the first landing page. And I think that it's funny, the people who are the potential patients who are doing that also, mm-hmm. I suspect might be better fits for your practice too.
Exactly.
Now, what about community involvement? You mentioned increasing your social media presence and marketing with your SEO and blogging. What about events online or in person? Have you been able to participate in local events to also get your name out there?
Yeah, I'm a huge introvert, so I didn't really used to go out a lot before opening my practice. But now I'm trying to show up in all kind of events just for people to see me and know me. And COVID hit, so a lot of these things moved online. So my drag queens are actually helping me a lot, telling me what's going on and where to go and where to be. So I'm relying very heavily on them for that. But I'm also attending business, Chamber of Commerce meetings. I gave a talk this past month in the Gay Chamber of Commerce, and I got patients from that talk directly. So that was helpful. So I'm trying to do more of that. It's just, I think I'm getting to a point where I'm just a little all over the place. So I'm going to need to reorganize and probably put these events on my calendar at least 2 or 3 months in advance so I can actually make it. But yes, I am definitely doing this. I think it's important to do that. I joined a lot of forums where my patients are online on Facebook, and also attending these different events in the community. And I don't have to always say anything. It's just, sometimes it's just a name tag or a passive comment. I don't try to be very salesy about it all the time, but it's just good for people to know I exist, so that when they need me, they know where to find me. And yeah, it's been really helpful. I also tried giving a free initial visit. I think there's a huge barrier just with people getting to know you, to actually engage with you and see you. They date you a bit in a way before they commit to you as their doctor. So they want to just make sure you're kind, make sure you talk about things with sensitivity, and then they come back. And there is a little bit of that. So I think just being there socially helps with that. helps for them to get to know you a little bit and see that you're not scary or scary and just not see you. And yeah, I tried giving free visits to some people to help with that. And so far it's been really good. Like I did it with 2 patients to start with, where I just didn't charge them anything. I was like, you need, I'll take care of today. Let me bring you in. And then both of them came back and signed up as paying patients. So I think that was helpful. Still thinking about risks and benefits of doing more of that because of malpractice and such. But I think attending events is definitely helpful. I don't have direct lead generation from that yet, but I think it's helping with just recognition in the community.
And like you said, seven square miles is a densely populated area where there's 50 plus primary care practices accepting patients. That visibility is so important.
Exactly. And after going to story branding, I really do think it's more about how I'm going to help each individual win their own stories than sitting down and talking about me and my business and how I do things. Like in a way, nobody cares, right? Like they just want to care about how you're going to help them win whatever they're going through and why they should knock on your door and not those other 50 doors.
Because you are a solo practitioner in San Francisco and a gay doctor, do you have any safety concerns when you go to work because you don't have staff or a resident artist there all the time with you?
I have safety concerns living in San Francisco. There's all of kind of unexpected events that happen. Like my business did get broken into, or like at least there were attempted breaks a couple of times at least. So there's that. There's definitely an element of that going on. In one medical, when I used to work, I was basically on my own, to be quite honest. Like in the model, we have some staff to help, but we don't have nurses or MAs or anything like that. So I was doing a lot of things on my own. And a lot of times I was in the office, like overtime, seeing patients with no staff. So I basically practiced in that setting for a while without having anybody else be there with me. The one thing that like did come up, it did come up when I was at one medical, and it was the issue of having a second person in the room, which is a chaperone, right? When you do sensitive exams and things like that. And the founder of One Medical, Tom Lee, trained in Mass General, and in their training, they don't have chaperones in their practice settings. And he had a lot of opinions about that. And they basically, I see definitely the arguments in both ways, like for and against. And we all know the arguments for. It's a good practice. It protects you legally from any claims or anything like that may come up. But the counter argument is everything is relationship based, right? You as an individual need to evaluate your strengths and weaknesses and see if you think you would be able to make each person comfortable if you're going to perform sensitive exams and obtain a consent for them to see if they would be comfortable with you doing that without a chaperone or not. And I think in a way it would even, I would argue, remove barriers for people to come and seek such exams if they know they'll just have less exposure, if they're really embarrassed about just being exposed and you're choosing to expose them to more people. So in a way, I learned from other people that were practicing in that setting, right? And learned from their lessons. And I haven't really had any issues. And I saw a lot of people at One Medical. I had like over 18,000 standard visits done in 3 years and never had any issues. But I was also super aware. So if I sensed something fishy going on, I would terminate that immediately, right? So I was good about setting boundaries as well. So I kind of know where I am with that and how I can practice safely. But it's definitely a thing. It's a thought. But I also, like, in terms of safety, I'm also thinking about like physical safety. Somebody is combative and physically threatening. That happened once in my old job. And I was alone, and they were between me and the door. So that wasn't awesome. I don't have a plan for that right now. I probably should. I probably should think about that. But like, it's such a rare occurrence. And again, like with that specific example, that wasn't a model where somebody was inserted in my exam room without me having any introduction. Didn't know who they are, didn't know why they're there, didn't know what they're expecting. And they were upset because I didn't deliver what they were asking for, which I would not have scheduled that visit if I was the person in charge, right? So I was set up for failure there by the system in a way. I would not do that to myself in my own practice. So I just don't think it's big enough of a concern for me to say I can't practice alone.
You're weighing the risks and the benefits, and you are making decisions based off of that. And I think that's the best we can do. I mean, yes, we can have some contingency plans, but I think that's part of weighing the risks and the benefits.
Yeah, and it's not only about this topic. You will find yourself answering so many questions when you're trying to start your own practice, thinking about what's an ideal setting. And for us as physicians, we're super risk averse, right? So we want an environment where nothing has a chance of going wrong. And it's great. That's why we're good physicians. And that's why people trust us with their health. But as a startup and a business owner, you can easily bankrupt yourself, sitting there and over planning of basically investing in everything that could possibly go wrong in the future and just spending all your resources building this place where theoretical risk can be handled before it happens. And I think that would not be a wise approach to a startup, especially if you're like me and self-funded, your practice fully. So I didn't have to spend a lot of money to open my practice and didn't take that. And that just having that mentality, the startup, building a minimum viable product that can deliver the care and understanding what my personal limits are in that setting has been really key. And just making sure that I don't fail, even when a global pandemic hits.
Very true.
Yeah.
You said it already, but yeah, what a year to open. Now, where do you see Oster Medical going in the future?
Good question. I think about that a lot, and it's exciting, right? Because right now, my goal is to get to a place where I have a full panel or close to a full panel. Step number one. But then I'm my brain is going crazy thinking of all the awesome things I could be doing. I'm super about technology in medicine, and I love seeing innovation and things that solve problems for community. Look at Atlas MD, what's doing for our community, for the DPC community. They created an EMR product for us that's good. And it's just good to see things like that. They innovated and took risk and went and built this one product. And I love seeing things like that. So I'm trying to do things like that on the side because it just is part of my professional fulfillment. But I also love medical cases with boundaries to access to care. I love caring for patients that have that and solving that puzzle for them. It's super rewarding. So in a way, I feel I would be super happy just caring for my patients and doing a couple projects on the side. Also, in a way, I think of how I could scale what I have to care for more people that are marginalized in other places. And I don't know today where I would be in 2 or 3 years. But sometimes I think about expanding the local family and hiring more docs. And sometimes I think about having small getaways in different cities where the LGBT populations access sensitive care. So I don't know. Maybe I'll continue to just operate in San Francisco, or maybe I'll just pop up in your town next. Who knows?
Nas, did you want to talk about your New York license?
Yeah. So I had a patient that was here with me, and I was caring for them, and they moved to New York and during the pandemic, and they were not comfortable seeing somebody else. So I actually ended up getting licensed in New York to continue caring for that patient. And I learned how to become really comfortable with telemedicine and thinking differently and innovating in that space. I definitely got that patient pushed me to care for my current patient remotely as well in San Francisco. So I really got into building a metabolic program to take care of patients remotely with the blood pressure and with hypertension and impaired glucose tolerance and things like that. So using Freestyle Libras and remote monitors and Fitbits that sync with your phone for me to get all the information remotely and just have telemedicine visits where I can view the data remotely has been a really good addition to the practice. For that particular patient, they had some cardiac issues, and it was pretty easy to look for a local cardiologist and connect them and then follow up with a consult note and continuing to deliver on the care. Whenever they needed a physical exam, I just found a specialist basically for them to see that specialized in that area. And to them, they had good income, they had a good PPO access plan. So that wasn't an issue. Their boundary to access was feeling comfortable talking to somebody about everything that's going on with them. So they decided to continue to see me from New York City after moving. So that could be a direction that I may continue to grow, but I'm not entirely sure yet. Still exploring the space.
Now, when you talk about innovation and using technology that integrate with a cell phone, for instance, do you have any tech or tools that you use and love in your practice?
So I'm in conversations now with a couple of startups in San Francisco, and they're creating different tools. Think of the butterfly, right? Like the ultrasound machine that a lot of DPC docs use. There is like one ultrasound company like that's local here that's reaching out to ask if I would use their machine and do free echoes in my office to test their product, or somebody else that has AI-empowered skin cancer screening. I haven't conversations with them, and I may start doing these, but I love being in control of all of it. If I use something like that, patients would 100% know that this is a startup that I'm using, and they would for sure know that it's not in place of seeing a dermatologist if I'm worried about melanoma, right? Or like sending a biopsy or anything like that. That wouldn't be a replacement for patient care. But I think my current patient population would actually enjoy seeing things like that. And I think that's the population of practice like Forward Medical is attracting. I think they are building their own tools. And I think that's what if people, it's just thinking that, or just seeing that you're open to different solutions to their problems. And what people don't see is that we're keeping up with like literature and guidelines and things like that on the back end. But there isn't something visible in front of them that gives them the signal that you're somebody that's not stuck in their way, basically, that you're somebody that's open to innovation, that's open to change, and that will continue to deliver the best thing that you can get for them. And to me, that would be like the main reason I would get into that space. It would be like intellectual curiosity, and also just like being like, there's just some excitement. I think like being around different people innovating in a space, and just it's like there's some contagious excitement about it. And I think I would love to keep that energy around. I don't use like tools right now in my office that are completely startup-y. Like I'm using like traditional products that all have been on the market for a while. And especially like starting up right now, I have a lot of kinks to work out just with my new practice and running it. So I think I need to get all of these things worked out first before I introduce new tools that are not validated or anything like that. You know what I mean?
Definitely. And that totally makes sense, especially for patient safety. And
completely. Yeah.
The number one goal of all of our practices. What about for those people who might be listening to you sharing your story, where you've come from, how you're treating patients, and where you might go in the future? What advice would you give to those folks who are considering DPC or about to open up their practice?
So that's a good question. I would say, just reflecting back on the 1 year I've been doing this, I would say get greener than continuously looking for the greener side, especially like right now after I opened my practice, was always easier to be comparative than focus on what's on your plate. I would say you really need to take care of yourself physically, mentally, and financially. Do that first. Be strong, because you're like your own business biggest asset. So you definitely need to invest in that. And then your family is going to be going through this journey with them. So definitely get their buy-in. It's going to be a family journey for everybody. I think that would be my biggest advice. And then I would just say one more thing for anybody that's thinking about venturing into the space is that right now I'm working many hours, and I work on weekends. I work in the evenings, especially in this stage. About 3 years ago, I had my 9 to 5 with decent income and the ability to climb to higher leadership positions. But I woke up one morning, I got ready, I sat on my bed, and I just said, I can't do this. And today I'm working a lot harder, and I'm full of joy. I love medicine, and I'm excited to grow personally, professionally, and to help innovate the space. I'm just so full of energy and joy. And I just thought that's just worth sharing with anybody that might be struggling or sitting with just dark moments, questioning if they find joy in practicing medicine anymore. Because I know I at least had a moment where that was a thought, right? Where it was a crisis moment. And it doesn't have to be the way it is. As somebody that changed their reality several times, you can change your reality. get up and do something different. Don't just be helpless where you are.
On that note, do you have any resources, not only about medicine, but also just about physician wellness or personal wellness that you used along your journey to recreate your reality and to keep moving forward?
Yes. So I would say that the DPC Docs group on Facebook honestly had everything I needed to open my practice. I didn't say much most of the time I was there, but it's because I didn't have to. Any thought I had was easily searchable in the group, and I was able to just get everything that I needed. It's really an amazing community. So definitely, if you're not there, you definitely need to be there to operate your own DPC practice. But I also found my local SCORE chapter, the nonprofit organization. I believe it's national nonprofit organization. I find them really helpful. I love learning my basic business skills from them. So I would recommend that as a resource. And personally, for me, I think my social support was my strongest asset and just helping me remain well. So if you don't have that, I would really recommend investing in that, because a sense of community in a way that you find meaningful and supportive and empathetic to your own journey is really, I think, has been the biggest help for me to remain strong, like with everything that's going on that I went through and that's going on right now. I think just having my colleagues that I worked with before that are now my friends, and then the different friendships that built, it just helps you go through every day like it's just part of life and not just spiral down your own head.
Yeah, and that sentiment is so important, especially after 2020, right?
Mm-hmm. Yes, definitely. Filling that cup is really important, isn't it? I think it's going to be really important in different phases in life.
What is the best way for others to reach out to you if they want to connect after the podcast?
Mm-hmm. So you can definitely find my contact information on my website. It's osramedical.com, OSRA medical.com. My email is md@osramedical.com, or you can also find my Facebook and Instagram pages. My handle is Osra_medical. You can find that, but if you go through my website, I'm pretty responsive to my emails. That would probably be the best way to reach me.
Awesome. Thank you so much, Dr. Mohammad, for joining us today.
Absolutely. Thank you for having me and thinking about me and my practice for your podcast.
Next week, look forward to hearing from Dr. Joy Johnson-Weaver of Resolve MD in Columbia, Maryland. Also, there is still time to register for our free Fireside chat with Dr. Rebecca Behrens and her virtual assistant, Angie Cortizo, this Tuesday, June 22nd. Can't go? Ask your question you want answered on our SpeakPipe voicemail and hear your answer in the recording afterwards. Visit speakpipe.com/mydpcstory to leave your question. And the AAFP DPC Summit will be held virtually July 16th to 18th. I released a bonus episode yesterday that highlights what we can expect from this year's summit. And two of the main highlights are, 1, there is an early bird discount of $200 if registration is completed by Monday, June 21st for both AAFP members and non-members. And second, there is a free medical student and resident focused track. Registration information can be found in yesterday's show notes and at mydpcstory.com. Take a listen and check out the show notes for more details. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.